To this session this morning. If our topic of conversation today is around how COVID-19 has affected us, how it's affected our businesses, and how we've responded, and ideally, hopefully, how we're moving out from a COVID year, a COVID situation, and how we're going to adapt and change in the coming years, and maybe what will stick, what good things we've learned, and what we'll be very happy to get rid of, and return back to the new normal. So the today's session it's a life science industry news supported session. Life science industry is the most widely distributed life science industry publication in our sector, with a distribution of over 40,000 named contacts, and an online audience of over 10,000 visits a month. Life science industry news is unique because it's run and delivered through a partnership between industry organisations, national organisations, membership organisations, and trade associations across the UK. So it's particularly well connected to its sector, to its audience, and particularly well equipped to deliver an event such as this one, where we've asked our speakers to give us an on-the-ground impression of their daily business activity from across the UK. So we have a number of speakers today, and we do represent lots of areas, regions within the UK, which is great. We have Rachel Hemsley, who's Global Head of Business Development at XenoGesis. We have Chris Dyke, Connectivity Manager at Medilink West Midlands. We have Charles de Rohan, CEO of the Binding Site. Graeme Hall, who's Executive Chairman at Brandon Medical. And Maria Stevens, who's Head of HR at Sharp Clinical. So welcome to all of you. It's a real pleasure to have you here today. I guess one of the differences between a online digital COVID affected conference and a live conference is that this slot, 10 o'clock on the morning after the main event, and probably the morning after the gala dinner and the sponsored receptions, would be a graveyard slot usually. But I'm pleased to say that as we probably all had to be at home last night and get to bed at a reasonable time, sadly we're all fresh and raring to go this morning. But nonetheless, I'm pleased to welcome everybody, all of our speakers here to today's event, and the audience. If you'd like to get involved, please, if you've got a question for any of our speakers or all of our speakers, then please do put them in the chat. We will be monitoring the chat. We will ask people to turn on their video and their microphones to ask questions that they've posted in the chat if we have time, or if the questions are too complicated for me to get my head around. Otherwise, we will try and pick up on the questions between speakers and at the end. So should be quite a relaxed event. It's a panel event, so we're not asking speakers to provide prepared presentations. We're all here to have an open and frank discussion that hopefully, given the expertise in the room, will be of interest to everybody listening. But please do get involved. I think the value of these type of sessions goes up considerably when we get insightful questions asked of the speakers. So I'm going to kick off things in the traditional way. And I'm going to ask each of the speakers in turn to just give me a few minutes just to introduce themselves, their background, their organisation, and then we'll move on to the topic of the day afterwards, which is COVID response and COVID reaction. So I'm going to go through in no particular order other than the way that people appear on my screen. And Rachel, you have the dubious honour of being my top left corner. So Rachel, if you'd like to introduce yourself, then you can get the ball rolling.
Yeah, hello from the top left corner. So yes, thanks for the introduction, and thanks for inviting me to be a panellist. So yeah, I'm Rachel Hemsley. I'm Head of Business Development for XenoGesis. We are a CRO based in Nottingham. Our expertise is focused in the preclinical space, in the preclinical drug discovery space, and our expertise is DMPK, bioanalysis, running PK studies, designing PK studies, PK, PD modelling, and dose prediction. So basically, we work with clients, helping them select the winners from the losers in their medicinal chemistry campaigns. So our clients range from, they're heavy biotech focused, to be honest, heavy biotech focused. We also work with universities, we work with some VCs, and we work with some pharma companies. It's been an interesting year, and there's been some challenging times, very challenging times, and there's been some really good times actually. And one of those sort of success stories was that we were also acquired by Signature Discovery in September of this year. Signature are actually one of our neighbours, and we collaborate with them, and in some respects we used to compete with them as well. So they are based on the same site, so in Bi-City in Nottingham. They do have a second site in Audley Park. And again, with Signature, we offer a much bigger drug discovery support for clients actually. So Signature, very strong medicinal chemistry provision. They've got DMPK, they've got biological services. So that's me in a nutshell, really.
Okay, I'm the first one to have done it, talking while on mute. So there we go. That's a reminder to everybody. Rachel, thank you very much for that, and thank you. Your business activity and your area of expertise is one that will be very familiar to many of the people in the Genesis community. So I'm going to move on now to the top right of my screen, which is Chris Dyke, who is Connectivity Manager at Medilink. Chris, would you like to introduce yourself and your organisation?
Of course. Good morning, everyone. So as Gwyn just said, I'm Chris Dyke, Connectivity Manager here at Medilink West Midlands for the time being, but I'll come back to that in a second. We are an industry engagement organisation similar to all the other Medilinks, and obviously Gwyn's organisation down in Wales, MediWales. And we are also the industry gateway for the West Midlands AHSN, which gives us a very wide spread of companies that engage with the NHS or looking to engage and sell into the NHS, and all of the sort of ranges of points of development that companies go through. And of course, as the topic we're going to be discussing shortly, we've seen many, many, many of those. But the reason I was sort of saying I'm at West Midlands at the moment, we are merging with our colleagues in East Midlands, a sister organisation, to form Medilink Midlands, which is a great new chapter in life of the Medilinks here in the Midlands, and obviously bringing together an even larger group of members to engage with one another and network, etc. So I think it's a really interesting chapter, as I said, in our business activities, and obviously, hopefully, we'll be speaking and meeting a lot more of you soon.
And an interesting time restructuring and joining together with your colleagues over in East Midlands, Chris. I'm sure you'll be telling us a little bit about that later on. So,
and do yes, of course.
Thank you for that. So, Charles from the binding site, you're next on my screen. So, can I hand over to you?
Sure, thank you. Thanks very much, Gwyn. Yes, Charles de Rohan, I'm Chief Executive of the Binding Site, which is a diagnostic company. We produce blood tests. We don't actually do the testing itself. We manufacture, we came out of Birmingham University about 35 years ago. I've been running it for the last 10 when I helped the founder-owner retire, who was a professor of immunology. I came in. Before that, I'd been in diagnostics around the world, basically from Europe and the Far East for the previous 15, 20 years. Came back to the UK at that point and to run this. And we, our main blood test, I mean, we're big from a UK perspective. We're probably the biggest diagnostic company there is in the UK. But we're not the Roche, Siemens, etc. We operate in certain specialist sectors, which effectively in immunology, so specialist immunology like vaccine response or pediatric immune system disorders, and our main part is really in blood cancers, in bone marrow cancer, specifically in myeloma. So we produce the antibody test. We have about 700 people working in the UK, mostly based in Birmingham, another 400 around the world. We export 90% of what we make, and we make it all in Birmingham. And so therefore, export is quite an important part, and ease of regulations, etc. We'll get onto that later. And the most recently we launched, I think, as in common with most other diagnostic companies, we launched a COVID test. But we can also talk a little bit about that later on as to the rationale behind that. But very pleased with the collaborations that we've had with various different institutions around the globe with that too.
So thank you very much for that. Thank you. And yes, as well as the impact on COVID, we probably are going to touch on other topics that are affecting people's businesses as we move into the new year. So yes, please do expand on that during the conversation. Next speaker on my screen is Graeme Hall. Graeme, thank you very much for joining us. I know you were asked to join us at quite short notice, so we really do appreciate that. I was asked as part of this event to bring in a bit of a medical device and medical technology flavour to today's conversation. So I know you're flying the flag for the medical side of the life science sector. So Graeme, can I give the floor to you?
Yeah, sure. Because obviously I've been spoofed by my wife who uses my Zoom account, so I'm not actually Jane. But there you go. Basically I'm a chairman and co-owner of Brander Medical, who we manufacture suites of medical equipment for operating theatres and critical care units. So pretty much the whole suites of equipment, and we integrate those and we build smart operating theatres. We were also founder members of Medilink back in 1994, so long association. And I'm been a director of Medilink Yorkshire and Humber, and now Medilink North of England for, I don't know, must be 12 years now. So yeah, obviously we're interested in the physical side of the environment, potentially all around the operating theatre, critical care units. We're about 50% UK, 50% export. I think we exported to 72 countries last year.
Thank you very much. So export and physical manufacturing and transportation very much a part of your business, which
yeah, absolutely, yeah. It's all manufactured here in Leeds.
Excellent. Thank you very much. Okay, so I'm now going to head over to the bottom left-hand corner of my screen, but coming back to Wales, where we're based, and Maria Stevens, who's head of HR at Sharp Clinical. So Maria.
Hello there. I'm afraid I'm a bit of a last-minute replacement as well. Our general manager, Ian Morgan, unfortunately was unable to make the call today. But on a positive note, I am part of the COVID task force leader for the Sharp UK. So hopefully I'll be able to contribute to the discussions on a more practical level today. My name is Maria Stevens, head of HR, and we're based in Rumney in South Wales. For anyone that maybe doesn't know Sharp, we are part of UDG Healthcare. Our team in the Sharp UK have been providing clinical trial, supply, packaging, labelling, distribution services since 1988, and I can confirm that we do have some staff that have literally been there since 1988 still, so a fountain of knowledge at our site. ISO 9001, ISO 13485 certification, and we also offer support for medical device packaging as well. I'm actually quite pleased to say that we, in our Rumney site, we've only been there up and running, I would say properly, for the last 18 months. We moved about 2 years ago. We were based in Crickhowell to what I now class as our world-class multi-phase manufacturing and packaging facility. We offer, comprehensive, fully integrated supply chain services for both clinical and commercial. It's actually this year that we've really started to focus on the commercial out of our site in Rumney. We've built out several new suites there, and I would say that's been a success for us. In the middle of everything that's been going on this year, we decided to start building and knocking down walls and creating a whole new side of the business, which, as I say, has been a success for us, while still obviously operating through the COVID-19. We do have 8 facilities across the US and Europe. blister packaging, secondary assembling, labelling, interjectable presentations, compliance packaging, all the lot. There's plenty you can see on the website if you want more information. Also track and trace serialisation services as well. So lots going on for us at Sharp, and continuing to operate successfully through this year, despite of obviously all of the challenges, which I'm sure we'll go into a bit later.
So thank you very much, Maria. And far from being a replacement, I'm really glad, given today's conversation, that we actually have an HR specialist on the panel.
I think Ian done it on purpose, so please don't.
Yeah, we can ask you all the difficult HR questions.
Oh, I love it.
So maybe we could stay with you, Maria, because
Okay.
I'm going to move on to the next question. So thank you very much for all of the speakers to introducing yourselves. And you all seem to have taken on a challenge that sounds a little bit counterintuitive, given the situation we've had this year. But I know that many of you have had some successes. So I'd like to drill down into that a little bit. And I'd just like to ask you about managing your business during the last 9 months, during the COVID pandemic. So about managing your business in a personal way, your staff, your logistics, the management of your facilities. What opportunities and what challenges have you had to face, as well as the challenges and opportunities that your customers have thrown at you. I know that some companies have been put on high alert because they have a business practice that's directly involved with COVID-19. Whereas other organisations have had to manage the storm because their products and services are less easy to manufacture and to use during the crisis. So I'm sure we'll have both sides of the story. But speakers, please pitch in and with a little bit of courtesy, but please pitch in and interrupt each other and ask questions across if you feel that you can contribute. But Maria, if I could start with you, because I know you've had a busy year, an award-winning project this year in terms of your expansion. So could you just tell us what that's been like through COVID?
Yeah, and interesting. As you know, obviously everything involves people. So I guess from that perspective, it's been a particularly hectic year for me personally within HR. I've suddenly become a COVID expert. As I said, I am the lead, but it's actually, with all of its challenges, I think that there has been more learnings and more positive experiences out of this year, as I think everyone has kind of gone through. I think for us, as I mentioned earlier, you know, we have built out our commercial operations this year. You know, that started in and around the January time, and we were up and running by the April-May time. So that was exceptional in terms of literally building out these suites. I think partnering with our construction company to be able to do that during a pandemic. So everyone's had lots of interesting challenges. I think our experiences in terms of Sharp has really ranged from, you know, supporting the clinical trial stage of packaging, labelling and distribution services, whilst also obviously trying to prioritise the health and safety of our employees. You know, virtual has just happened overnight. You know, our departments that have always said we could never work from home, within 24 hours, suddenly we're working from home. So I think from that perspective, you know, we have gone work from home, virtual meetings, virtual tours, virtual audits. You know, it's been absolutely astonishing how everyone has turned that around, and obviously with our customers as well at the same time, having to operate and work at the pace that they have, whilst again everyone having their own challenges, in particular the work from home piece. As you can imagine, it is quite hands-on, but what we've had to do at our site is protect our production and warehousing staff, because they're the critical people that can't work from home. So, you know, where possible, we have had, you know, 95% of our people that can work from and operate from home have been doing so. It's only probably in the last number of months that we've started to see some people. I know we've got Deb Williams, one of our business development managers, on the call today, and she'll be able to attest to the difficulties being in business development and the sudden switch of not being able to go out and about. I mean, Deb hasn't been allowed at our site for a number of months. So yeah, it has been challenging, but I think overall it's probably had more positives and learnings in terms of moving forward in a quicker way. I think more than anything, you know, we've all amazed ourselves at how quickly we've been able to adapt to this, and the hope is obviously to continue with those learnings moving forward and to be able to put that new mentality and way of working and culture into supporting our customers in a more effective and efficient way moving forward as well.
Thank you for that. One question I've got for you, because I have personal experience of having to interview, onboard, give induction, and start new starters, and without actually meeting them face to face, and working with that team for over 6 months, still without having met them face to face. Is that a challenge in your world?
Yes and no. It's interesting, but I think because we're so global, we operate anyway in this type of environment on a regular basis. But certainly it's sometimes a bit more of a leap of faith because you literally can't meet those people. But I think, and I'm going to say it because I'm in HR, but I think with robust and strong HR and recruitment practices, then it's always going to be successful. So yeah, it's been definitely a new way of operating. And I think more so for the managers that now have people virtually, you know, that we've had to go out and retrain our management teams on how to operate in a virtual world. You know, a lot of these guys have never experienced that before. So it's been a complete new type of management skills that we've had to go out with and adapt to, and do it on a very, very quick turnaround, I guess. And, you know, some people have struggled with that and some people have thrived on it. But thankfully, you know, it's worked out so far. I haven't had to fail anyone's probation, so we're all good.
Well, that's a success. Excellent. Yeah. Rachel, you were nodding and smiling through some of that.
Absolutely, that having to react very quickly and having to go to virtual overnight. What I was smiling at was that you managed to move to 95% people working from home. That's astronomical, actually. Yeah. For us, I thought we were doing well. We moved 50% of our staff to working from home pretty much overnight, and that was a big sea change for us. I mean, like every business, it's the safety of your staff and your colleagues and your friends, actually, but trying to keep the business afloat and alive, and providing business continuity. So still providing those services to the clients that you've had for months, years, even weeks, just new clients even. And so for us, because we're a preclinical CRO, we can't all work at home. It's a non-starter, really. So we have 50% of the staff still in the offices and the labs. And for us, it was, well, what do we do and what can we do to make sure that those guys are in a safe environment and that we can still operate as a business. So, you know, I was smiling at the 95% element. I thought that's going some. For us, I think we were quite fortunate, actually, as well. So about 2 years ago now, we moved premises. And so we had a growth plan in mind anyway. So we added an extra sort of 83% foot space to the labs and offices we moved into. And that paid dividends. You know, if you take 50% of your staff out and you've got additional space, it suddenly means that you can work in ways that keep everybody safe. And so we certainly had additional spacing. We put in flexible working hours. I'm certainly aware that some CROs closed. I'm also aware that some CROs moved to shift-based systems to reduce sort of the connectivity and potential sort of infection that may occur in that kind of environment. For us, you know, it's a case of putting up additional screens, screens everywhere, and you were saying Deb's not been into the office, and I'm BD. So the only time I've been into the office in 9 months was because we were acquired by Signature Discovery. So it's a case of I went in sort of for 3 days over a spacing of 3 weeks, and I was really impressed. You can sit on as many directors' meetings as you like and hear about all the strategies and things that you're putting in place, to actually rock up to the site and to see that there are screens everywhere and everybody's spaced. And even our weekly meetings, everybody's on a headset, so you don't crowd round. There's not a big enough office. We took on additional office space actually to help for meetings. And again, smiling at you, Gwyn, we were growing. We had to go through a recruitment phase as well, and it was a case of how do we do with this? And you're flexible, aren't you? You have these kind of meetings, but we took on a big office, so we could actually physically meet people as well. So they might have been sort of 3 meters away from us, but you have that physical interaction. And as you were saying, tours had to be physical for us, and likewise with the acquisition. We were acquired by our neighbours. Brilliant. They're only sort of three floors up from us, but introducing the staff has been sort of not the usual. Or let's have canapes and champagne and just talk and do that thing that all humans do. It has been an element of small tours, but again, there were outbreaks of COVID in Nottingham, so we sort of stopped that because safety was critical. So there are interesting times, and I think humanity is unbelievably flexible, actually, isn't it? When you walk back into your office for the first time in 6 months, and you say, okay, so there's only one person allowed in the coffee room, and you swab everything down. As soon as you go into a meeting room and you finish, you swab everything down. Here's the key to the room. I'm sanitising it and passing it over to you, and when you give it back to you, or you give it back to me, sorry, you do the same. So there's an element of human on human empathy and protection, but that then flows into making sure that your business can survive. So sorry, that was a long-winded answer to that. No, I was nodding out.
No, it's really interesting. So it has been more to do with social distancing and COVID security rather than working from home for a lot of your team.
Yes and no. I mean, we were. I don't know what the appropriate word is. Let's say unfortunate. It's not the best word. It's a bit of an understatement. One of our founders died from COVID in April, so that went straight to the heart of the company. And the view when we were in February, March, April, looking back at those times, the whole country, the whole world did not know what was coming. Is it going to be sort of an Ebola type virus? Is it going to be your next plague, or is it something that we can contain and manage? So we, right at the beginning, the senior management team basically set up their own Cobra team, because you saw the way the government was reacting. There were new regulations and new information every day. So we had to react to that. We're a small company, so we don't have big corporate pockets. So we also were aware of, well, actually, how are we going to survive this? And so things like non-essential spending were instantly cut. Obviously, on BD, I was stopped travelling from sort of February on anyway, and it's a way of keeping everybody safe, but trying to keep your business alive and keeping people employed, actually, and delivering to our clients. Because especially in drug discovery, it's a busy time. It's a busy time.
I'm going to move on to ask you about your clients in a little while, but can I just bring in Graeme here, because you're obviously you're in a business where working from home for a lot of your team just wasn't an option in manufacturing. So can I have your reflections on that challenge?
Well, yeah, it's slightly different in many ways. I think in many ways we did see this coming in December last year, because we're an exporting business. We do a lot of work with people in Asia, and the effects they had with SARS-2. They were telling us this was coming. We could see it was coming, and so actually we started reacting very, very quickly. In fact, lots of the people around in our environment thought we were crazy, doing putting the measures in place to make the premises COVID secure, to off-site the people that we could. Identifying the vulnerable people first, taking measures to make our manufacturing site a COVID-safe site, which we've not had a day's closure. We have a manufacturing site, we've got people here working all the time. We haven't had any transmission inside the business whatsoever. We did off-site a lot of people, so they were working from home. And actually, on the second lockdown, we've taken measures to actually make sure that people aren't off site all the time. Most of them have to be here at least 1 or 2 days a week, because we started identifying people who've got some known mental health issues, some people who had mental health issues that we didn't even realise. The isolation that they were experiencing was actually really bad for them. And also the issue of coordinating people. We're social animals, and people find it a lot easier to coordinate activities and teams, and the creative and innovative side of our business as well is damaged by people not being with each other. So actually, we've come back to work in the second lockdown in a slightly different way. We've intensified the COVID security measures inside the business, so that we can actually have people here at least part of their working week. And I think that'll probably last long term now, that people will spend part of their time working from the office and part of their time home working. But I think there's been a massive realisation amongst our team that actually working from home is, it's nice for a while, but actually it's cohesively damaging to people if they, especially if they don't have a social life because they're in lockdown areas, which a lot of the areas around Leeds are. Kirklees and Calderdale have been in lockdown for all but 3 weeks of this year. So it's those people haven't had a social life outside of home and work.
Absolutely, and yes, that blended approach to in sort of later periods during the lockdown or the second wave definitely resonates with us. I have to say, just reflecting on Rachel's comment as well, that it's coming back to the office after a period of months. I was amazed just how many drawers and letter trays were full of junk that I didn't have any problem with leaving behind for 6 months, and there was an awful lot of junk in there that I could probably just throw straight in the bin, because if we were able to survive without it for 6 months, then it probably isn't needed at all. Charles, you're in an area that you couldn't send everybody home.
No, we couldn't. I should point out, this is my first day since March of working from home, by the way. But we did have, so we had 700 people on site generally up until the 23rd of March, and then immediately thereafter 300 were at home. And I think the first challenge was fear, and managing the fear that was inevitable in an organisation that big, and just trying to ensure that we understood which way up was, and how, and taking it extremely seriously, and trying to make sure that we could help everybody to work from home who needed everybody who needed to shield, everybody who had childcare issues, all of that. We needed to ensure that they were in the right place. It was very much about the employee first, but at the same time recognising that as providers of diagnostic kit, those tests needed to go out globally on that side too. And so it was really trying to work out how to ensure that we were probably hoping to be one step ahead of the government regulations or requirements on what COVID secure meant. And so making the safe spacing, all of that side of it was extremely important internally, as well as just trying to ensure that we had enough sanitizer, enough all of those, and face masks, etc. The question is, do we use them in the building or just in the laboratories? So all of those things were very much a moving feast, and it was a question of ensuring that we communicated to everybody. So I used to, I think, basically every morning I'd send out a daily update of what had happened the day before and where we were going, and what changes or otherwise there were. But basically also to ensure that you kept those 300 who were at home engaged and understanding why they were at home, what they needed to do, and where we were heading as a business. Because clearly April was a time when hospital laboratories in Europe and in the US, just basically all hospitals said, we are COVID, that's all we're looking at, we're managing that. So, we went from, we generally, we pride ourselves in sort of mid-teen growth year on year, and we saw April sales were at 65% of the previous year's numbers. So the question was, is that going to continue? Is it going to go down? How do we manage that? And to your point, Rachel, in terms of managing, expenses, clearly, I mean, people couldn't travel, let alone even if they wanted to. But those sort of non-discretionary items were really important. And we focused very much on ensuring that current customers were supplied with current products that they needed. And that was massively important. The nice part is that May went up to sort of 90%, and by June they were back up and growing happily, because the hospitals, and I think now we see even in this sort of second wave, the hospitals, laboratories, etc., healthcare establishments have found a way of managing both. They know they need to manage the patients who have non-COVID related disease. They don't, and they have them in a sort of COVID secure environment too. So that's really important in terms of being able to manage both of those. I know it goes through troughs and peaks in terms of pressure, but internally we have, to your point, you said we had no internal transmissions, nor have we don't think, but we did have the NHS track and trace with the Bluetooth thing. We had 17 people told to self-isolate and come back on the same day. And we are convinced that is because they all put their phones in their lockers. And and one of them was told to isolate, and they're immediately, all of them were. So that was a bit of that. So we've reminded them on that. So one thing to be aware of: tell them to turn their Bluetooth off when they're in the office. But I think the main part was communications, making them feel comfortable. And now we have less than a handful of people out either self-isolating or with a positive result themselves. But it's been quite an interesting 9 months. We've learned a lot about how we communicate. We've learned a lot of how we collaborate as well. And I think teamwork has been especially positive in this last 9 months, as people have really got to grips with what reality is.
Definitely a renewed feeling of purpose across a lot of organisations, where people actually understand what they're doing and why they are doing it.
And how lucky we are to be in these organisations and not in a hospitality organisation running. That's the other part. We absolutely recognise that there are so many of our colleagues, friends, and families, who've been without work.
Yeah. So, Chris, you've had contact with your membership over the last 9 months. So you've got a wide pool of experiences to draw upon here, but some themes developing there around. There's the maintaining business practice, but then there is also the engaging those at home, managing self-isolating absenteeism. Does a lot of that resonate?
Obviously, being normally an office-based organisation, that main tools of the trade is the telephone and the internet. Then obviously a move to home wasn't too big a jump. But obviously that came with a whole series of other issues, which you sort of alluded to. Most of our staff have young children, and obviously that mix and blend of trying to keep doing the work and deal with children who needed schooling and all the other sort of things that go along was obviously a whole new skill set that everybody had to deal with. And as probably most of you on a Zoom chat have known, that they have partners at home, walking through back a screen, having those sort of interruptions as well. But I'm sorry about we've got an energy saving light system which descends to just as a feel. Not the best of things in these sort of situations. So, no, it's not the boss trying to save some money on switching the electric off. So yes, it's been an interesting time, but I think for us this year, and as Charles was saying, we're so lucky to be in this sector, but it's also been such an interesting and dynamic time to be in this sector. I think we've done more work in this year than we do in normal years, because the demand, the requirement, and for us in this sector, the realization of the services and the work that we do has all of a sudden come to the fore, where obviously we've been a sort of hidden service. So, and that goes with obviously the public and obviously I think other inter-organizational relationships, you know, in the private sector, public sector sort of areas, because all of a sudden they had need and demand of us and how we could help them. On the industry section, and maybe you'll come to this, you know, obviously it's been a great time for meeting so many new companies and new businesses. So it's been a whole new skill set, I guess, that all of us had to learn through obviously doing things like this. How's that going to affect us in the future? Because we're all so used to the meet and greets and events and trade shows, etc. How do we go forward with that? So I think that's a new skill set that we'll probably need to understand it and learn. You know, it's that same sort of thing. The future's bright. I don't know if it's orange, but it's certainly bright, except when the lights switch off. You know, there's a lot of interesting things. Trying to keep on top of it all and the demands. And what has also been interesting of recent, from my perspective in our region, is we're seeing a lot of interest from overseas for all sorts of reasons. So we're seeing, you know, increasing interest and requests for potential inward investment, which at this sort of time seems counterintuitive, you know, because nobody's moving, nobody's traveling. But they obviously see there's opportunities, and I don't think it's related to the B word. I think it is just that there's a lot going on, and they see that there's business opportunities here in the UK. So,
absolutely, yeah. And I think maybe there are certain things like due diligence and investment practices that can be done digitally online, and in fact, with us all sitting not far from Zoom, you can actually talk to anybody in the world. Which has created a more unique environment for that kind of activity. It's definitely something we've seen. And in terms of your own business practices, yes, it does. It resonates with us as well, in that, I mean, MediWales is a community. It's about interactions and relationships and joining people together. And our first impressions were everything stopped. But it was only a few weeks until we realized that we were actually more in demand. To help create those connections and those collaborations in a more challenging environment. And then within a couple of months, we were doing exactly the same job as we've always done. We were just using different tools to do it. So yes, that does reflect our experience as well.
Our days have got longer as well, I think.
Yes.
We're not traveling.
Yes. So I just wanted to move on to, just conscious of time, I just wanted to move on to a little bit to the changing markets. And I know that some of the organisations that you represent are selling into healthcare and into the NHS or healthcare providers abroad, and others of you are in different other places in the supply chain. But I know that most markets have changed as a result of COVID. So maybe if I could start with Graeme on this one and just say, have you had a significant change in your customer base or your markets or the demands that your customers have made on you as a result of this pandemic?
Yes and no. I think after we'd secured the base of our business, because with the crisis, with looking at our customers, people, and then continuity of the business, the next thing we started looking at was, well, how can we help? As an organisation in healthcare. We have certain assets. It's not our field, isn't respiratory care, but what can we do? So we moved into that area. We were involved with the ventilator challenge program. We sourced ventilators from overseas from our export distribution network to bring into the UK to add to the government's program. We also were involved in making parts for ventilators. So we made 3,000 sets of parts for ventilators on our equipment that's normally used for making theatre equipment. And we also assisted with the Nightingale hospitals. So we had a little bit of stuff that we make that goes into those, but we could also assist with the design of the medical gas systems and the oxygen systems. So it was a case of repurposing what we've got to actually help out in the crisis. And then when that crisis passed, it's looking to the future, which I guess as a a panel we really ought to be talking about what happens next. It's much more interesting for people to listen to. Yeah, for us, we're involved in hospital designs. We can already see hospital designs being changed so that they've got some peak rapid response built into them, so that if there's a future pandemic, elements of the building can be isolated to deal with this type of activity, rather than infecting a whole general hospital with COVID and having to stop all of its elective operations. So I can already see that happening in the design of current hospitals in the UK and overseas. There are quite a number of COVID rapid response units that have been designed that can be deployed in future very, very quickly. Looking longer term, it's quite clear that there's not enough critical care and ICU beds in the UK. We've got an under supply compared to the rest of Europe anyway. And then, of course, a case hits like this, and our ICU critical care facilities are just swamped. So we see that there's a future need for more intensive care beds. We're already seeing some additional intensive care units being designed in some of the core cities of the UK, and that's got to be something that the NHS invests in over the coming years. And then, of course, we've got this massive backlog of elective surgery that's built up, and there's got to be measures taken to actually reduce that list. Probably with the best will in the world, some of those people on that list, the older patients, will never get treated now. But if you look at the amount of elective surgery that's built up, there's got to be some activity to increase the supply of elective surgery that we can deliver in the UK, and maybe subcontract some of that list. I think certainly a lot of it will go to the private sector to actually take up the slack.
Absolutely. So yeah, very direct. Firstly, a response and reaction to the demands of COVID, and to use that phrase that lots of people have used recently, pivoted your business practice to respond to that, and then some more permanent changes in the market. So yeah, that's really interesting. Can I ask Charles whether that's
yeah, sure. I mean, pivoted. Well, I wouldn't say we pivoted, but we expanded, I suppose, because was clear was, I mean, the general public are now far better aware in the UK of diagnostic tests, which they never were before. Now when I say you have got, we make blood tests, they go, oh, that's really interesting. Whereas before they didn't know what they were. So that's a positive, I think, from an overall expansion perspective. But it was clear that the first few tests that were produced were not anywhere near the quality that we would want. So we work collaboratively very closely with the University of Birmingham, with the immunology department there, and we came up. We had talk about collaboration. It was really quick and really easy to talk together, to combine forces with them, with the University of Southampton, and with the NIS in the US, to identify the right protein, which is the spike protein that everyone's now aware of, to use as the target for that test. And I think we started discussion on Good Friday, and 4 months later had a test validated, proven for antibody testing. So at the end of August, which is now being shown to be sort of in the 98.5% sensitive and specific, which is tremendous especially from a vaccine response perspective. So that's where we're going to in that side. But realistically, we've had to keep our existing business going as well, because those tests still needed. So it's been remarkable in terms of the galvanizing of whole groups of different people within our organization, from the R&D concept people through the manufacturing to the logistics, to get this through regulatory approval for something that would normally take 18 months. 4 months is phenomenal, because we are a regulated business, rightly so. So we've seen, I hope that one of the legacies will be that the UK, which traditionally spends less than half of what Germany does per capita in diagnostics, actually will think of trying to get early intervention by diagnostic testing and treatment sooner in intervention, rather than waiting for them to get really sick. That would be my hope coming out of this.
Absolutely. Absolutely. So can I ask Rachel to respond to the same topic? So changes in your customers' demands over the last year, but also a lasting legacy that that made, you know, positives as well as negatives that have come out of this.
Yeah, I mean, for us, we've not, because we're a preclinical CRO working in drug discovery, we've not seen a huge change in our client base. What we did see was, you know, as the discussions around Wuhan and concerns that China was going to be closing down, we saw an increase in general inquiries saying, well, do you have capacity? Can you do this? As a lot of sort of big pharma have obviously outsourced their drug discovery to China. So they had concerns as to whether they'd be able to continue with business, and they were looking for alternative suppliers. What we also saw was the universities had closed as well. So there were plenty of companies that were running drug discovery with universities, and suddenly all the universities were shut, whereas the CRO sector, in the main, remained open. So the CRO sector remained open. So we did have people circling around saying, look, is there any chance that we could move our drug discovery projects to you? And we did have some interesting challenges where we had certain clients having to take compounds out of a university because it was shut and get them across to us so that we could test them for them. But in the main, yeah, we've sort of maintained that same client base of a large number of biotechs, a few universities, some sort of VC funders, etc. We have seen, I would say, existing clients. I mean, while all of this is happening, and I can certainly see from a medical device perspective, etc., and a diagnostic perspective, there is a pivot that you can make. From the biotech sector, that's non-COVID, actually part of it is still pretty buoyant, and certainly we've seen some of our clients form major alliances and or being acquired, so that actually the buoyancy of the biotech industry at the moment, and I was reading stats the other day saying that there's the highest number of IPOs for the best part of 5 years, something like 59 IPOs that have happened. Actually, that side is still really buoyant, so we are still serving those guys. So for us, it's been less of an impact on the client base. We've not had to swing. It has been maintained. We have taken on the odd COVID project, so that is something that we've adjusted to. And then there's obviously the health and safety issues that may surround that. So in the main, we've been very fortunate. I think is the bottom line. We've sort of been buffered left and right, but we've remained steady, and beyond that, look to expand, which is phenomenal news. So hopefully that answers your question, Gwyn.
Apologies for that. My post has just arrived. Who mentioned the postman earlier?
That was my worry, actually. So a postman always arrives when you're on a Zoom call.
It was very cheerful anyway, so apologies. So no, thank you for that. And Maria, yes, changes in Sharp's business practice, but also as you are our resident HR expert, are there lasting changes in HR that are going to be as a response to where we've gone?
Yeah, I mean, I think from a Sharp perspective, we've certainly had our ups and downs this year. You know, I think in particular for the clinical trial, you know, a lot of things have been put on hold, been pushed out and pushed out and pushed out, and that's obviously come with its challenges and difficulties. But to say, thankfully, we've obviously expanded into the commercial side, so that's buffered, given us a bit of a buffer at our business. I think there's also the direct to patient has now become quite a big thing, obviously, within our organisation. You know, it is something that we've already been doing in the US, but it's certainly something now within Europe that's coming to the top of the agenda as well. So there'll be a lot more, I think, emphasis on that over the next number of months and to see what we can do there. But I think in terms of the HR side of things, I think you know, a lot of us have already mentioned all of the differences in terms of practices and how we operate. You know, flexible working is obviously a massive one. We've all shown our capabilities, which, you know, from a HR perspective, it's going to be very hard to now anyone turn around and say, no, we can't support that. Because yes, we can. So, you know, I think even from a legal perspective, you know, I know I was on a call the other day in terms of going through the employment tribunal situation, which is, you know, cases are now being you know, plugged in for 2022. There's that much of a backlog, but there's also a large increase in terms of things there to do with flexible working in particular. So I think we all have to operate in a different way, you know, and actually we've got no choice but to continue those practices because we've proven them to work. So it's, you know, there's going to be an interesting time, I think, ahead. So I just hope that businesses and managers don't forget how flexible we've been, but also I think how flexible our staff have been, and that we continue to operate in a culture moving forward that allows that, because the reality is people want that anyway. You know, and we've seen a very high influx of over probably even before COVID hit of, you know, well, do you provide flexible working? Can I work from home? And I think now we've proven that we can do that. So yeah, it'll be an interesting time ahead, I think, from a legal perspective, in terms of how we operate as managers, as leaders, and how we treat obviously our staff as well, and to show that gratitude back moving forward too.
Absolutely, definitely. There's going to be some ambiguity in how people work practices change, and how HR and especially larger organisations where you have to show equity across the whole organisation in everything you do. That is going to be a bit of a challenge for you and your colleagues. I mean, I definitely, from my point of view, I've totally changed in my perspective as far as presence in the office. You know, I've always been quite old-fashioned about wanting the whole team in the office during core hours, and I've used the fact that somebody's got to answer the phone as an excuse for that. Well, that's out of the window now, and so I think we're going to downsize our offices, and I think working from home for at least part of the team is definitely something that's going to.
It's interesting, actually. We talked about moving out of the office. You know, our UDG offices in Dublin, you know, went to 100% work from home.
Yeah.
You know, this is brand new facilities, and it's like, really, do we need these facilities anymore? So, you know, yeah, it's definitely going to be a completely different way of operating moving forward.
That's fine for your office-based people, myself and Chris's team, whereas Rachel, Charles, and Graeme are going to be a little bit more challenged by keeping the labs open and the manufacturing open. So it is going to be a blended model. I think our time is up. I want to just say very quickly, I want to say that if you take a look at Lifescience Industry news magazine online, so that's lifescienceindustrynews.com, then you'll find lots of other interesting stories about COVID, and how our industry and how our businesses have responded and the successes that they've had. I want to say a big thank you to Sam for pulling today's event together. Most of the speakers will have had communications with Sam during the last week or two. He's turned it around very quickly. A big thanks to Genesis and One Nucleus. Great job. You've done a great job all week, and thanks for this opportunity. And on that, I will hand over to Eileen at exactly 11 o'clock.
Amazing, Gwyn. And a big thank you to you. Really interesting discussion, really topical, of course. And thank you, Gwyn, for brilliantly chairing it and keeping it on time. So just quickly for me, this session was recorded. So if you want to get back to it, of course, you will be able to at the end of the full Genesis festival, if you want, on the 16th of December. And that's also available for members afterwards, or after the 4 weeks period post-Genesis. So today we have 3 more innovation workshops, one in a half an hour on digital skills, attracting digital skills to life science, another one this afternoon around preparing for public market, and then another one on advanced analytical workflows for our lab-based members and delegates. So hope you enjoy, and more on Monday, Tuesday, and then lots of on-demand content to watch as well. And also the app is still open for organizing meeting and chatting with delegates. Thank you very much. See you later.
Thank you so much. Thank you. And thank you so much to the speakers.